Welcome to On the Beat. Isaac hosting again this week, and I have with me Robert White from Robert's Apothecary, of course, longtime guest here on the Beat. Robert, thanks for joining us.
Glad to.
All right, Sarah with us as well, a special guest. Robert, tell us who she is and what she does for you.
Okay. It's Sarah Lloyd, and she is a graduate of Ole Miss Pharmacy School. She joined us a couple of years ago, and she is in charge of managing and operating our compounding lab where we do special medications.
Perfect. All right, well, we'll get right into it then. So Sarah, compounding lab, managing that. So what exactly is compounding?
So compounding allows us to make medications that are specific to each patient's need. So that means that these are not commercially available products. You can't just go to your regular pharmacy and buy them. We are actually hand making them in our compounding lab. So for example, if you need something that's dye-free or because you're allergic or you don't want your pediatric patient to have dye, we can make things that are dye-free. We also can take tablets, crush them and make them into suspensions. And then we also have a lot of medications that we're able to incorporate into creams and gels, and that you can actually apply those on your skin topically.
Okay, and it will still work it the same way as if we swallowed or took it by, mouth, whatever.
Yes.
Okay, interesting. So what kinds of compounds do you specifically specialize in? I know it's patient specific and patient need specific, but is there something that it's like your specialty maybe?
Yes, our biggest area is actually bioidentical hormones. We do those for men and women. We also do a lot of creams and topicals for pain management patients. And then, like I said, pediatric patients, if there's a tablet that's too big, they can't swallow, we can make it into suspensions. And then also we do a lot for the lower GI tract for our gastro clinics. We do a lot of compounds for them as well.
So, and you mentioned kind of the age groups. Is there a specific age group that benefits the most? Do you see somebody kind of needing this mostly, out of a different age group? Like who would benefit the most, I should say?
I think for the most part, our hormones are our biggest benefit. That's one of those, one size does not fit all.
Sure.
So especially for women, we're able to do lab work and we can see your levels, and then we are able to dose the hormones that are directly for like what you're needing them for based on your symptoms and where your levels are at.
Gotcha. Any other specialty things about the compounding lab that we should know about?
Like I said, we do a lot for pain management. So patients who maybe have to take 4 or 5 pills at a time to manage their pain, we can actually put those into creams. And so instead of having to take a bunch of pills by mouth, you can actually apply it directly to the affected area.
Okay.
And then with the lower GI tract, we do a lot of topicals and suppositories for hemorrhoids. So for those patients, we're hoping to prevent or prolong the need for surgery.
Excellent. Robert, you want to add anything? Is this like a new lab at the pharmacy here, or has it been there and Sarah's the new addition?
Well, Sarah is the new addition.
Okay.
And I started compounding professionally in the early 80s, so way back. And over time, the state regulations, pharmacy board, and the federal regulations have ramped up, and 6 or 8 years ago, they raised the bar so high that we had to build a separate building, clean rooms inside this building, just for compounding.
Gotcha. Great information there, Robert, Sarah. We sure appreciate you joining us today. And if you have any additional questions or need any additional information, it is listed there on your screen. We're back after this.